Hey everyone, and welcome to another deep dive. You know how sometimes we just feel down? Well, today we're going to tackle that feeling head on. We're diving deep into depression with this chapter from the Handbook of Clinical Psychopharmacology for Therapists.
Yeah, this chapter really breaks down how depression can look so different from person to person and how so many things can kind of play a part. It's not always a simple diagnosis.
Exactly, and that's what we're here to untangle today. How can we tell the difference between just having a bad day and something more serious? How can we sort through all the complicated stuff about depression? That's our mission for this deep dive.
Yeah, that's a really important distinction, right? We all have those days where we feel down, but when does it become something we need to pay closer attention to? And this handbook actually highlights how tricky that line can be.
Okay, so let's get right into it. I see here that the book talks about different levels of depression. What are those levels?
Well, it breaks it down into three levels: reactive dysphoria, grief, and then clinical depression. So reactive dysphoria, think of it like a little dip in your mood. It's like a reaction to everyday stuff that stresses us out, like a deadline at work or a fight with a friend.
So it's like when you burn your toast in the morning. Annoying, but not a big deal.
Right, exactly. You might feel frustrated for a bit, but then you move on. And then there's grief, which is a whole other level of intensity. It's that deep, prolonged sadness we feel after a major loss, like when someone close to us passes away or a relationship ends. And this can last for quite a while, a year or two even.
Grief is definitely powerful, and it sounds like the book emphasizes that it's a healthy process.
Oh, absolutely. It's how we deal with loss and eventually heal. It's not something to be afraid of or try to avoid. In fact, trying to push it down can actually do more harm in the long run.
That makes sense. So then, how is grief different from clinical depression?
Well, clinical depression, it goes beyond just feeling sad. It's marked by this persistent low mood where you lose interest in things you used to enjoy, and it starts affecting your everyday life, your sleep, your appetite, your ability to focus, your energy levels, even your physical health.
So it's like a chronic condition, as opposed to grief, which is more of a natural response to a specific event.
Yeah, that's a good way to put it. And while clinical depression can be triggered by something big happening in our lives, it can also just show up seemingly out of nowhere.
And I imagine the causes of clinical depression can be pretty varied.
You're absolutely right. Unlike reactive dysphoria or grief, it can be a mix of biological stuff, things happening in our lives, and even our personality traits.
Okay, now we're getting into the mystery. Like our detective is trying to figure out if the case of the blues is because of our genes, a tough situation, or maybe even some underlying personality stuff.
I like that analogy. And this book really gets into this whole personality and depression connection. It's a topic that can get pretty complicated.
It definitely seems like an area where things can get a little murky. Can you explain that a bit more?
Of course. So sometimes when someone going through a major mental illness like depression, it can actually bring out personality traits that weren't so noticeable before, or maybe make existing ones more intense. Like imagine someone who's deeply depressed starts acting in ways that seem a lot like borderline personality disorder. But then as their depression is treated, those behaviors kind of fade away.
So it's not that they actually have a personality disorder. It's more like the depression is sort of mimicking those traits.
Exactly. It's like the depression is putting on a mask, giving us a false impression of their true personality. But on the flip side, there are times when certain personality patterns can actually make someone more vulnerable to depression in the first place. For example, someone with a dependent personality might be super sensitive to separation, which could make them more likely to experience depression after a breakup.
That makes a lot of sense. So basically, untangling personality from depression is really important for therapy and for deciding on the right treatment.
Exactly. And that's where a skilled therapist comes in. They need to be able to figure out all these different factors and come up with a plan that addresses the individual's specific needs.
This is all super interesting. I'm already getting a much clearer picture of how complex depression can be.
And we're just scratching the surface. There's a lot more to uncover.
Well, I'm ready to keep digging. But before we go any further, let's take a moment to think about what we've learned so far. We've talked about the different levels of feeling down, from those quick tips to the powerful impact of grief and the complexities of clinical depression.
Right. And we've started to look at how our biology, our experiences, and even our personalities can all play a role in whether we're more likely to experience depression.
So for everyone listening, think about this. What parts of this conversation resonate with you? What factors might be at play in your own experience or for someone you know who struggles with this?
Those are great questions to reflect on as we continue our deep dive. And in the next part, we'll get into this fascinating concept called psychological masquerade, where physical illnesses can actually look a lot like depression.
That sounds pretty intriguing. We'll be back after a short break.
Welcome back to our deep dive on depression. Before the break, we were talking about how personality can be all tangled up with depression. And now I want to shift gears a bit and talk about something else that's really important, physical illness.
Okay, yeah, you've got me curious. We touched on how some physical conditions can kind of mimic depression, but it sounds like there's more to it than that.
There is. It turns out a lot of people who are seeking help for mental health issues, they actually have physical illnesses that haven't been diagnosed yet, and these illnesses are playing a part in their symptoms. The research this book talks about suggests that this could be as high as 17%.
17%. Wow, that's a lot of people who could be getting the wrong diagnosis. What kind of illnesses are we talking about here? What could be mistaken for depression?
So the book breaks it down into three categories. The first category, these are illnesses that don't directly mess with the central nervous system, but they can still trigger emotional responses. Like imagine someone who becomes depressed after a spinal cord injury or gets diagnosed with something serious like glaucoma. Those are life-changing situations that could really affect anyone's mental well-being.
Right, those are huge life changes that could throw anyone off balance.
Exactly. The second category, these are illnesses that directly affect the central nervous system and they impair how well our brains work. So things like traumatic brain injuries, Alzheimer's disease, even the effects of long-term substance abuse on the brain. In these cases, it's the physical illness itself that's causing changes in the brain, leading to those psychiatric symptoms.
So it's not just an emotional reaction to being sick, it's the illness actually messing with the brain's ability to regulate mood.
Exactly. And then the third category, this one is probably the trickiest to figure out. This category includes illnesses that affect our brain chemistry but don't necessarily cause noticeable problems with how our brains function. So these are often things like thyroid disorders or conditions that affect how our bodies process nutrients, things like that.
So someone could have symptoms that look like depression, but their brain function might seem totally normal on those standard cognitive tests.
That's right. That's why it's so important to look at the whole picture when we're trying to understand someone's experience with depression. We can't just jump to the conclusion that it's all in their head.
This whole psychological masquerade thing is fascinating, but it's also kind of scary. If I was a therapist working with someone who might be experiencing this, what are some red flags? What would make me think I need to refer them to a doctor for a medical evaluation?
That's a great question. And this book actually offers some really good advice with that. So, first of all, pay attention to when the symptoms started. If those psychiatric symptoms just kind of hop up out of nowhere without anything specific happening in their life to trigger them, that's a warning sign.
So it's like depression appearing out of the blue with no obvious external cause.
Exactly. Another thing to watch out for is if the person is over 55, they're at a higher risk for all sorts of medical conditions that could be contributing to their symptom. Also, be really careful if the person is taking multiple medications, because sometimes those drug interactions can cause psychiatric side effects.
Right. It's a good reminder for all of us to be aware of potential drug interactions, even with stuff we get over the counter.
Absolutely. And of course, family history is important too. If there's no history of similar psychiatric symptoms in their family or even in their own past, that should raise a red flag as well.
So if the depression seems to have come out of nowhere with no genetic predisposition, that's a sign to dig a little deeper. What about physical symptoms? Do those help us identify potential medical causes?
Absolutely. Look out for any unusual physical symptoms, especially if they showed up around the same time as the depression. Things like being tired all the time for no reason, pain, changes in appetite or sleep patterns, or any neurological stuff, and a recent head injury, that's something to always take seriously.
This is a really helpful checklist. It really shows how connected our physical and mental health are. It's not always so black and white.
You got it. It really highlights how important it is for mental health professionals and medical doctors to work together to make sure people get the best possible care.
It sounds like figuring out the right treatment starts with doing some thorough investigating to uncover all the pieces of the puzzle.
You nailed it. And speaking of treatment, that's another really interesting part of what we're diving into today. In the next segment, we'll be talking about all the different treatment options out there, from therapy to medication to lifestyle changes.
I'm looking forward to that. But before we move on, let's circle back to this book for a minute. We've been talking about how physical illness can disguise itself as depression. But this chapter also talks about substance use, right?
Yes, it does. Substance use can be a big factor when it comes to depression, both in pausing it and in making it worse. Sometimes it's the main culprit, other times it's just part of the problem.
So it's another layer of the mystery we're trying to solve.
Exactly. Think of it like this. Our brains rely on this delicate balance of chemicals called neurotransmitters, right? These neurotransmitters control our mood, our sleep, our energy levels, and a bunch of other stuff. When we use substances like alcohol or drugs, it throws that balance off.
So those substances can kind of hijack our brain chemistry, making it harder for our brains to work properly.
That's a perfect way to put it. And the effects can be different depending on the substance, how often it's used, and the person's own unique brain chemistry. For example, alcohol is a depressant. It slows down brain activity and can make feelings of sadness, hopelessness, and fatigue even worse.
I think we've all felt that morning after a feeling after a night of drinking where you're just kind of down and sluggish.
Exactly. And for someone who's already struggling with depression, alcohol can be a real trigger. It can make their symptoms worse and make it harder to recover.
What about caffeine? I mean, we all need that morning coffee to get going, but could that be playing a role in depression too?
It can. Caffeine is a stimulant, so it speeds up the nervous system, which can increase anxiety. And we know that anxiety and depression often go together.
So the caffeine could be feeding the anxiety, which then makes the depression worse.
Exactly. And it can also mess with our sleep, which is super important for regulating mood. Not getting enough sleep can make both anxiety and depression worse, and that can create this vicious cycle.
So it seems like substance use can really make things complicated when we're trying to understand and treat depression.
It definitely can, and it's something that needs to be carefully considered and addressed as part of any treatment plan. In fact, sometimes the most important first step in helping someone recover from depression is dealing with any substance using issues.
So it's like our detective needs to think about all the possible suspects, including those sneaky substances that might be hiding in the background.
Exactly. We need to gather all the evidence, figure out the clues, and then come up with a plan that targets the root causes of the problem.
This deep dive is really eye-opening. It's showing how depression is not always what it seems on the surface.
You're right, but by understanding all the possible factors that contribute to it, we can help people take charge of their mental health and find the best treatment options for them.
And that's really what it's all about, right? Giving people the knowledge and tools they need to navigate all of this. But before we jump into the treatment discussion, let's give our listeners a minute to digest all this information. We've covered a lot of ground today, from personality to physical illness to the impact of substance use. Take a moment to think about what resonates with you. What new insights have you gained about your own experience or the experiences of people you care about?
Those are some great things to reflect on. And while you're thinking about those questions, we'll be right back to talk about the different ways we can treat depression, looking at both the biological and psychological approaches.
Welcome back to the deep dive. I feel like we've learned so much already about all the different aspects of depression. We've looked at the different forms it can take, the things that can cause it, and how even physical illness or substance use can be a part of the picture.
We have. It's been quite a journey, and now that we have a better understanding of just how complex it can be, we can start talking about treatment.
Yeah, let's get into that. How do we actually address depression? What does this book have to say about the most effective ways to help people?
Well, the handbook, it focuses mainly on the role of medication, but it's clear that psychotherapy is super important too, especially when personality is a factor.
So there's not just one solution that works for everyone.
No, not at all. The best way to treat depression really depends on the individual, what their depression looks like, and what other factors might be contributing to their symptoms.
I like that. It's kind of like tailoring a suit. You have to consider each person's individual style and needs to get that perfect fit.
I love that analogy. A treatment plan should fit seamlessly into the person's life, addressing their specific challenges and supporting their overall well-being.
Okay, so let's break it down. What are the key takeaways from this book when it comes to treating depression?
Well, the first thing it emphasizes is the importance of a really thorough assessment. Remember all that detective work we talked about earlier? Gathering all those clues, the person's history, their personality, any other medical conditions they might have, their substance use, if any, it's all crucial for putting together a treatment plan that actually works.
Yeah, we've talked about that a lot today, getting the full picture. It seems like that's really the foundation for everything else.
Absolutely. Once we have a clear understanding of what's going on with the individual, then we can start looking at different treatment options. And as I mentioned, this book really focuses on what it calls pharmacotherapy, basically using medication to address the biological side of depression.
So that would include things like antidepressants?
Yes, exactly. Antidepressants are often a key part of treatment for clinical depression. They work by targeting certain neurotransmitters in the brain, the chemicals that help regulate our mood, like serotonin, norepinephrine, and dopamine.
But we've also learned that sometimes medication might not be enough on its own. What about the role of psychotherapy?
Right, psychotherapy is super important for dealing with the psychological and social aspects of depression. It can help people learn how to cope with their symptoms, challenge those negative thoughts that can get stuck in their heads, improve how they communicate and build relationships, and deal with any past trauma or emotional issues that haven't been resolved.
So therapy can give people those tools and strategies to manage their depression and make real, lasting changes in their lives.
That's the idea, and sometimes the most effective approach is a combination of both medication and therapy. It's about finding the right balance and creating a plan that really meets the individual's needs.
So we've talked about the importance of assessment, the roles of medication and therapy, and the need for individualized treatment. Is there anything else from this book that we should highlight?
Yes, the handbook really emphasizes the need to monitor and adjust treatment over time. People respond differently to medications and therapies, and their needs can change as they go through the recovery process. Regular check-ins with a qualified healthcare professional are so important to make sure the treatment plan is still working.
So it's not just a one-time fix, it's an ongoing process.
Exactly. Recovering from depression, it's a journey, and it takes ongoing support and adjustments along the way.
This has been such an incredible deep dive. We've uncovered so much about depression, the different types, the potential causes, and how vital it is to get a thorough assessment and create a personalized treatment plan.
And we've seen how understanding all of this can empower people to take control of their mental health and seek out the support that's right for them.
It's like we've built a whole toolkit for navigating the world of depression. We've got our detective skills for figuring out the clues, our understanding of how biology and psychology work together, and now we have all these different treatment options at our disposal.
I love that. And remember, knowledge is power. The more we understand about depression, the better equipped we are to manage it for ourselves or for the people we care about.
That's so true. And before we sign off, I want to leave you with this thought. We've talked about how depression can show up in all these different ways. It could be like a thief stealing our joy, a fog clouding our minds, or a heavy weight dragging us down. But no matter how heavy that burden feels, remember, there is always hope. With the right support and the right treatment, you can lift that weight, you can clear that fog, and you can reclaim your joy.
Beautifully said. And if you're feeling inspired to learn more, remember there are so many resources out there to help you on your journey.
Absolutely. Thanks for joining us on this deep dive into the world of depression. We hope you found it informative and empowering, and maybe even a little bit inspiring. Remember, you're not alone. There's help available, and there's always hope for a brighter tomorrow. Until next time, keep exploring, keep learning, and keep diving deep.